So one question we often get asked by families is what they should do if they're concerned about a loved one and want to help a loved one who's in an emergency, a psychiatric emergency. And that's a very important question. And everyone who knows or cares for someone who has a mental illness should be able to know the steps they can take if they're worried about a loved one in a crisis. I think one of the most important things to go over is what constitutes a psychiatric emergency. And that could be many different things. Of course, thoughts of self-harm that a person could act upon or suicidal ideation is a true emergency, and it's a medical emergency, should be taken very seriously. Thoughts of wanting to harm another person, whether that be something that the person has been thinking about for a while or all of a sudden thinks about in an impulsive way, could also constitute a psychiatric emergency. New onset of symptoms that are very concerning in our field, like psychotic symptoms. Hearing things and seeing things are difficult to explain. Having terrible thoughts that something bad's about to happen in such a way that the person can't be reassured. These kinds of delusional thoughts can also be very concerning for psychiatric illness and may need emergency evaluation. And of course is very distressing to the person and to the loved ones around them. Other things also could be psychiatric emergencies. For example, severe disorganization and not being able to take care of a person's own well-being. Their activities of daily living, for example, due to a psychiatric illness can also be evidence of an emergency happening. Sometimes people may be intoxicated and unable to control their own behaviors, and maybe they could inadvertently harm themselves or harm somebody else. That would also constitute an emergency. The new onset of manic symptoms, the new onset of side effects from a medication, from a mental health medication. Those can be severe enough that that could also be an emergency. All of these issues need to be taken seriously.